Your dog sits down, lifts the back legs, and suddenly drags their bottom across the floor. It looks funny, but the message may be serious. That movement is called scooting, and it usually means the skin or tissues around the anus feel itchy, irritated, full, or painful. One quick scoot after a bowel movement can happen because of minor residue. Repeated scooting, however, deserves attention. The most common explanation is a problem with the anal sacs, often called anal glands, located just inside the anus. These two small sacs produce a strong-smelling fluid used in scent communication. Normally, pressure from firm stool helps empty them. When the fluid becomes too thick, the ducts narrow, or the sacs do not empty well, pressure and discomfort can build. The dog may scoot because friction against the floor briefly relieves that pressure, even though it does not solve the underlying cause. Other clues include licking or biting near the tail, suddenly sitting down, avoiding sitting, or acting uncomfortable during defecation. A strong fishy odor is another classic warning sign. It may come from anal sac fluid leaking when the sacs are overly full or inflamed. You might also notice a small oily or brownish spot on bedding, carpet, or the place where your dog was sitting. Impaction means the sac is packed with material that cannot leave normally. Infection can follow when bacteria multiply inside the trapped fluid. If infection progresses, an abscess may form. That can be intensely painful and may eventually rupture through the skin beside the anus. Redness, swelling, blood, pus, a draining wound, or severe pain are not signs to monitor casually. They require prompt veterinary care. Some dogs cry, snap, hide, or refuse to sit because the area hurts. Pain can change behavior, even in a normally gentle dog. Small dogs are more commonly affected by anal sac disease, but any breed can develop it. Size alone cannot tell you the cause. Soft stool or recurring diarrhea may contribute because the stool does not press firmly enough against the sacs during defecation. Constipation can also alter normal emptying and make bowel movements painful, creating more irritation around the rear end. Being overweight may make natural emptying less effective in some dogs, and extra skin folds can make hygiene more difficult. Allergies are another important possibility. Inflamed skin around the rear can itch enough to trigger scooting, licking, and biting. When scooting appears with itchy paws, recurrent ear trouble, red skin, or seasonal scratching, an allergy may be part of the picture. Food sensitivity, environmental allergens, flea bites, and secondary skin infection can all contribute to inflammation around the perineal area. That is why repeated gland problems sometimes return until the underlying skin or digestive issue is identified and managed. Now, what about worms? Parasites can cause scooting, but they are not automatically the most likely explanation. Tapeworm segments can crawl near the anus and cause irritation. They may look like tiny grains of rice around the fur or bedding. You may also notice dried yellowish segments where the dog sleeps. A fecal test can sometimes miss tapeworms because segments are shed intermittently. The common flea tapeworm is linked to swallowing infected fleas, so effective flea prevention is part of preventing reinfection. Other intestinal parasites may cause diarrhea or general irritation, but scooting alone cannot identify which parasite is present. Random deworming is not a substitute for diagnosis. The correct treatment depends on the parasite, the product, the dose, and the dog. Scooting can also come from something much simpler: dried stool, matted hair, or moisture trapped beneath the tail. After diarrhea, even a small amount of residue can irritate delicate skin and create a powerful urge to rub the area. Frequent wiping, harsh soap, scented products, or aggressive grooming can make that irritation worse instead of better. Clipper irritation after grooming can also cause redness and scooting, especially when the skin is shaved very close. Grass seeds, sand, dried mud, or another small foreign material may become trapped and irritate the skin. A careful external look can help you notice obvious debris, swelling, redness, discharge, a wound, or rice-like parasite segments. But do not insert anything into the anus, press hard on a painful lump, or repeatedly squeeze the anal sacs at home. Incorrect expression can cause pain, tissue damage, incomplete emptying, or delayed treatment of an infection or mass. Human hemorrhoid creams, disinfectants, essential oils, and leftover antibiotics can be unsafe or inappropriate for this area. The safest first step is to observe the pattern. Did it happen once or several times in one day? Is your dog licking constantly? Check for odor, stool changes, visible segments, swelling, pain, appetite changes, or unusual tiredness. A clear photo of visible swelling or a sample of suspicious segments can help your veterinary team, as long as you do not delay care. Contact a veterinarian when scooting repeats, lasts more than a brief episode, or returns again and again. Seek faster care if there is a fishy odor with pain, a lump beside the anus, bleeding, pus, or an open sore. Straining to defecate, crying during bowel movements, refusing food, lethargy, fever, or sudden behavior change also justify prompt evaluation. A ruptured abscess may temporarily reduce pressure, but the wound still needs treatment. Improvement after rupture does not mean the problem is over. At the clinic, the veterinarian will examine the skin, feel the anal sacs, and check whether the contents are normal, thick, infected, or painful. If infection is suspected, the material may be examined under a microscope or cultured to guide treatment. A fecal test may be recommended when parasites or digestive disease are possible, especially with diarrhea or visible segments. Treatment depends on the cause. An impacted sac may need professional expression and flushing, while infection may require medication. An abscess may need drainage, pain relief, antibiotics, warm compresses, and follow-up until the tissue has healed. Allergy-related scooting may improve only when the allergy, flea exposure, or secondary skin infection is managed. Parasite treatment must target the actual parasite, and flea control may be essential when tapeworm reinfection is involved. For simple external irritation, the plan may involve gentle cleaning, careful grooming, keeping the area dry, and treating the source of diarrhea. Prevention begins with consistent stools. A complete diet, adequate water, and veterinary guidance can support digestive regularity. Some dogs benefit from additional fiber, but more is not always better. The amount and type should fit the individual dog. Maintaining a healthy body condition can help overall mobility, hygiene, and normal pressure around the anal sac region. Regular flea prevention and veterinarian-recommended parasite control reduce the risk of preventable itching and tapeworm exposure. For long-haired dogs, keeping the fur beneath the tail clean and neatly trimmed can prevent mats and trapped residue. Routine wellness exams matter because a veterinarian can detect recurrent impaction, skin disease, or a small mass before it becomes obvious. Routine anal sac expression is not necessary for every dog. Some dogs empty normally and should not be manipulated without a reason. Dogs with repeated problems need an individualized plan rather than endless squeezing. The goal is to understand why the sacs keep filling. Rarely, scooting can be linked to a perianal wound, fistula, polyp, or anal sac tumor, especially when a lump or persistent bleeding is present. These causes are less common than impaction or irritation, but they are another reason not to ignore symptoms that persist. So, when you see the scoot, do not laugh it off and do not panic. Look for the pattern and the clues around it. A single brief episode without pain may only need observation. Repetition, odor, licking, swelling, or discomfort calls for a closer look. Your dog's strange behavior is often communication. Scooting is not bad manners. It is a physical signal asking you to notice. The earlier the real cause is found, the sooner your dog can return to sitting, walking, and resting comfortably. Watch the scoot, check the clues, and let a veterinarian evaluate anything persistent, painful, swollen, bleeding, or unusual. Because understanding the signal is one of the simplest ways to protect the dog who trusts you with everything.